the amendment is what's before us, and I recognize Senator Friedman for some opening remarks.
Thank you, Mr. President, and through you to the members. The Senate's big picture goal for our health care system has been and continues to be to create a system that delivers affordable, equitable, high quality, and accessible care to all our residents. We also acknowledge and support the role of our pharmaceutical industry plays in developing life-saving medications and supporting our economy. However, I think for anyone who has spent time trying to understand the system of drug pricing and delivery, and believe me, my staff and I have spent months and even years trying to do that, you cannot be anything but extremely frustrated and deeply affected by the profound negative effects this system has on people who depend on medicines to keep them healthy and in many cases save their lives. These people are our residents and our constituents. We all know the numbers. 2 in 5 people in the Commonwealth who have health insurance have difficulty accessing the care and medicines they need because of cost. We know that heart conditions such as coronary heart disease and high blood pressure affect persons of color at twice the rate of their white counterparts. We know that over 1.3 million people with diabetes are forced to ration their insulin, and over 70% of those people actually have health insurance. And the stats go on. And the sharp break between those on the front lines of creating life-saving medications and delivering care and those in the business and profit of healthcare is profound. More and more, and at an ever-growing faster pace, our healthcare system has been and is being taken over by large corporations and private equity companies that have a vested financial interest in every part of the healthcare supply chain, including the provider organizations that deliver your care. And that interest is profit and keeping the system running exactly the way it is. And when we do a deep dive, we find a system that is complex and opaque beyond any rational explanation. A system where it's easy for the major stakeholders to point blame at each other in an effort to avoid making any changes that will actually benefit the most important stakeholder, the consumer. And we are constantly being told, without being presented with any real and independent data, that increasing transparency of the system in a meaningful way or trying to control the cost of essential drugs is going to raise costs for all other medications, that our premiums will increase or will pay more for the medicines we need at the pharmacy counter. The insurers blame the pharmacy benefit managers or PBMs. The PBMs blame the pharmaceutical manufacturers. The manufacturers blame the PBMs. The PBMs blame the insurers, where, by the way, the largest PBMs also own the insurers. Again, there's no real data to back up this narrative. We're told the data is proprietary or will interfere with the ability to negotiate prices if we regulate it. But since we have no visibility into the process, how do we know? How do we know what's accurate? This is the healthcare world we find ourselves in today, and the urgent need to address all of this has never been greater. People simply can't afford their health care anymore. So here we are again, addressing some old challenges and new ones as well in constantly evolving environment with reasonable and thoughtful proposals that reduce the burden of healthcare costs on our residents. And we've done this before. We've taken up the challenge in 2012 when the Commonwealth took a first-in-the-nation forward approach to control the costs of healthcare. At that time, the focus was rightly on carriers and providers, our hospitals and insurers. And the world has changed since then, and new players and forces have entered the healthcare market. And now it's critical to take the very next important step and focus on reining in ballooning prescription drug costs and overseeing the practices of those that control the industry. The Senate has acknowledged this and in the past several years has been a leader in putting forth policies to address the unaffordable costs of drugs. In our FY20 budget, we included language to allow MassHealth to negotiate supplemental drug rebates directly leading to millions, hundreds of millions of dollars of saving each year. And in 2019, we passed the first iteration of the PACT Act. And last session in 2022, the Senate passed the second iteration of the PACT Act. And we continue that work today as we take up and hopefully this time pass the third iteration of the Act relative to pharmaceutical access, cost, and transparency, also known as PACT 3.0. This legislation once again takes a comprehensive approach to address the high and rapidly increasing costs of prescription drugs for consumers and the healthcare systems as a whole. The PACT Act 3.0 includes and refines several provisions from last session's Senate PACT Act and additionally contains several new provisions that go further than the Senate bill did last session. Similar to the previous bills, the PACT Act 3.0 contains enhanced accountability tools to address high costs and patient access issues for certain drugs. The bill directs the Health Policy Commission, HPC, in consultation with stakeholders to establish a process for identifying expensive drugs or significant drug price increases that pose a public health threat to our residents and the state. It then authorizes HPC to evaluate and define a proposed value for these drugs, and if a drug price does not exceed HPC's proposed value, HPC may engage with a wide variety of relevant stakeholders, including the manufacturer, to identify and recommend steps to help our healthcare system and the state pay the fair price of the drug in order to improve patient access. The drug's price substantially exceeds HPC's proposed value. HPC engages the drug manufacturer in an affordability and access improvement plan process to address the drug's price, similar to the performance improvement plan process for hospitals and insurers we use today. Development of a plan can be interactive and is confidential. If a manufacturer declines to work with HPC to develop the plan, HPC is permitted to publish the proposed value of the drug and hold public hearings on its proposed value findings. HPC may also level fines if the manufacturer willfully obstructs the HPC's work. Also similar to previous iterations, the PACT Act 3.0 provides more transparency and includes pharmaceutical manufacturing companies and PBMs in the annual healthcare cost trends hearing. Today's bill will add drug costs to the scope of healthcare cost analysis annually conducted by HPC and the Center for Health Information and Analysis, CHIA, and empower these agencies to collect a range of drug cost information from pharmaceutical manufacturers and PBMs to help us truly understand the cost drivers of pharmaceuticals from the manufacturer to the consumer. Furthermore, by participating in this process, the pharmaceutical industry, both manufacturers and PBMs, will be held to that same accountability and transparency bar as our providers and payers in HPC cost control efforts and cost trends hearings. And like previous iterations, the PACT Act 3.0 requires pharmacy benefit managers to be licensed. PBMs, who act as the middlemen in the drug transaction process, play a major role in determining drug costs, yet they are highly, and sometimes not at all, unregulated. The bill increases a licensing process for PBMs, which will allow the state to directly regulate PBM activities and help ensure that PBMs are truly serving the best interests of consumers and the PBM's client, health benefit plan sponsors, when they negotiate with pharmaceutical manufacturers and pharmacies on drug prices. I know that one of the love letters that everybody got concerning how happy the stakeholders were in this bill referred to the fact that this bill may prohibit or step into the area of ERISA plans and insurers and employers' ability to negotiate. They do not. This bill does not do that. We do not regulate ERISA plans. We are very clear that this does not affect ERISA plans, but the federal government has ensured and ruled that we can, states can oversee pharmacy benefit managers. So it's a big difference between the plan and the PBMs. So I just want to make that clear for folks. We've been very clear that we do not violate any of the rules of ERISA. We need to put the emphasis back on the consumer and the insured, and that's what the regulating PBMs will do. And similar to previous Sessions Bills Act, the PACT 3.0 requires early drug price notification. It requires pharmaceutical companies to notify the state in advance of new high-cost drugs and biosimilars or significant increases in brand names or generics coming to market. With advance notification, the state's mass health program, the GIC, and commercial insurers can better prepare for potential cost increases. And as common practice in the several states across the country, the bill codifies the practice of charging the lowest of the cost-sharing amount, the negotiated price, and the retail price when a consumer is picking up a prescription drug at the pharmacy, ensuring that the consumer can pay the lowest price at the pharmacy counter. In addition to the provisions I've just mentioned, the PACT Act goes one step further in addressing the high costs of essential life-saving drugs to treat chronic conditions and advancing health equity. The bill provides immediate price relief for certain drugs to treat diabetes, asthma, and heart conditions, all of which disproportionately affect communities of color and low-income populations. As I said earlier, many residents are forced to severely limit or entirely forego their use of these essential drugs because of the cost. Those costs easily reach thousands of dollars for the many people who are in high deductible plans or underinsured. Forcing these patients to pay exceedingly high amounts to access a drug that they simply cannot live without is, to say the least, unconscionable. To address the problem, the PACT Act 3.0 limits out-of-pocket spending for residents by eliminating cost sharing for selected generic drugs and the devices necessary to deliver those drugs, and capping co-pays at $25 per 30-day supply for selected brand name drugs and the necessary devices used to treat these chronic conditions. If we are to continue to make progress in reducing the cost of healthcare, we must take meaningful action to reduce the cost of drugs. The PACT Act 3.0 will put Massachusetts at the forefront of state efforts that acknowledge this critical role played by the industry and at the same time tackle rapidly rising drug costs by providing greater drug price transparency, improving oversight over the pharmaceutical industry and pharmacy benefit managers, and reducing overall drug costs to patients and our healthcare system. As I said before, the pharmaceutical industry plays an extremely important role in the healthcare space, one that we truly value and support. Innovation and business success are critical to all of us. At the same time, the ability to buy needed medications is more and more beyond the reach of our residents. We must bring these two realities into better balance, and the PACT Act takes meaningful steps to accomplish that balance. And please, make no mistake, these two efforts, supporting our industry and reducing drug costs for patients, are not incompatible. It simply requires real data, a willingness, and an honest partnership to make our #1 focus those who depend on a system that is equitable, accessible, and affordable for their health care and for their lives. I'm enormously grateful to have been given the opportunity and responsibility to help craft this bill with you. Thanks to the Senate President and Chair Rodrick. And I am grateful especially to our respective staffs. Liz Berman, Adelina Ho, Wade Homer, Steve Acosta, Fatou Sidibe, on my staff, smart, fast on the turnaround, and completely committed to the work we do here in the Senate. I want to thank especially to Liz, who is the staff lead, shepherding her first big bill, did an amazing job of keeping all the balls in the air and managing all the complexities while helping her boss not run into every burning building and die on every hill, even when the urge to do so was overwhelming and probably not productive. Tova Miller and her team in Ways and Means, thank you for your flexibility and partnership. Nathan Hostert, thank you for joining our team and for all the work that you have done. And special thanks to the truly incomparable, brilliant, and always calm and patient Colby Dillon from the SP's office, true partners and counselors in this endeavor. I'm also enormously appreciative of the diverse array of stakeholders that show a continued willingness to sit down with us during this process and talk through many of the concepts included in the final bill. And I want to thank all of you, my colleagues, for the incredible amount of support and understanding and partnership that you have shown during this time for this very, very complicated issue. I really appreciate it. And I ask, Mr. President, then when a vote be taken by the call of the yeas and nays.